you're dealing with a very complex problem. It's not something that can be solved overnight.
We are experiencing a lot of service demand for primary care at this time, and we are also facing a crisis in family medicine where we are losing a lot of family doctors to retirement.
We knew we had a huge care gap in the provision of primary care, but we didn't have any idea of the magnitude of that care gap.
We are facing a primary care crisis, but we don't know how big that problem is.
It is a collaboration between Ontario Health Toronto and the Canadian Health Workforce Network. So this approach was a result of the need to address equity in Toronto and help to allocate primary care resources to those who needed them most. We have also engaged Ontario Health teams in terms of building workforce planning capacity. The toolkit has been well received in this process.
I've been able to share with other OHTs that this toolkit is a massively useful and, in fact, essential tool for us to plan the population health needs moving forward.
Before having access to the toolkit, we felt like we were shooting in the dark, not really knowing where to focus.
High-quality data is critical to this process.
Before we had the toolkit, we had no idea of the measure of the challenge we were facing. The socio-demographic data that the toolkit provides really broke things down for us. We used the toolkit very effectively to actually know the size of the care gap, the number of caregivers that we need currently and that we would need in the future.
I hear a lot of stories. I hear stories about doctors that are feeling burnt out, doctors that are not wanting to continue work within a certain space. So I have stories. The data has helped in putting numbers to the stories that I'm hearing about.
The data has been extremely helpful in our planning process. We know that now the gap is very big in North Toronto. A new investment will be needed to help us address the magnitude of the problem we're facing, but we won't be able to do it all at once. So the data in the toolkit helped us to prioritize, focus on areas with the greatest needs.
Engagement of local providers is important to help with interpreting of the data, validating of results, and also filling in gaps that the data cannot provide.
The toolkit is one important set of information. However, I think that the engagement work that went with sharing the toolkit needs to be highlighted. That's the difference for me, is that there is now an engagement and conversation between the data analytics experts and, I'd like to say, the experts in terms of the stories on the ground, where we see the patients, we see our colleagues, we see the community of practice of difficulties that we're facing.
Using the data, we've been able to develop a fulsome business proposal and provide team-based care to our population. We wouldn't have been able to build the business plan without the toolkit information.
Between those of us in health system planning locally and those of us who are in health system planning in government, we need to speak the same language. We need to understand each other, and we need to understand what we're talking about. And the toolkit that was provided to us helped us work with similar language that we can use, so that we then get the resources that we need to actually implement solutions in the community.
What I want people to know about this data toolkit is the level of detail that it provides. It tells you who lives in these neighborhoods, how many providers are in them, what allied health is available. It also shows you projections of what these neighborhoods are going to look like 3 years from now, 5 years from now.
I would urge all OHTs to use this toolkit in an iterative fashion so that moving forward they can get up-to-date information about the populations they serve so that they can provide the care that those populations need.
This is really helpful information when we're making decisions about how to create equitable distribution of health human resources.